Hi guys, welcome back to the channel. If you're seeing me for the first time, I'm Nurse Comfort, and for my returning subscribers, I want to appreciate you all for your support. So in this video we are going to be talking about different nursing specialty. Why do people specialize? People specialize to gain an advanced knowledge and skill in a particular nursing field. As a nursing student, when you graduate from nursing school or from the university, you are regarded as a general nurse until you do a specialty. So in this video, I'm going to be sharing different nursing specialty. If you're interested, please let's dive in. So number one, we have the cardiac nurses. These are nurses that care for patients with heart conditions or disease. Any cardiovascular problem is the duty of the cardiac nurse to care for such patients. Number two, we have the renal nurses. They care for patients with kidney diseases. They also carry out dialysis procedure and also care for patients awaiting transplantation. Number three, we have the ICU nurses. These are nurses that care for critically ill patients in the intensive care unit. Number four, we have the A&E nurses. It's mostly a busy ward. These are nurses that care for emergency cases like accidents, any acute diseases, until a patient is stable and transferred to their appropriate ward or appropriate team for further management. Then we have number five, we have dermatology nurses. These are nurses that care for patients with any skin condition. Number six, we have the aesthetic nursing, though not very popular. These are nurses that provide cosmetic care to patients seeking to improve their appearance. Then number seven, we have the pediatric nurses. The pediatric nurses, these are nurses that care for children and adolescents. Then we have the neonatal nurses. Number eight, we have the neonatal nurses. These are nurses that care for neonates, specifically children from 0 to 28 years, and also they care for preterm babies. We have the geriatric nurses. Geriatric nurses are nurses that care for elderly patients, old patients that are unable to fend for themselves. Then we have the radiology nurses. These are nurses that prepare patients undergoing a diagnostic imaging procedure like an X-ray. They care for such patients. Then we have a nurse midwife. A nurse midwife are people that offer antenatal care, they take delivery and also postpartum care to women. Then we have psychiatric nurses. Psychiatric nurses are nurses that care for patients with mental disorder. Very interesting specialty. When I was in nursing school, I wanted to go into psychiatry, but right now I'm not really sure if that's what I want. We have the ophthalmic nurses. These are nurses that care for patients with any eye condition or illnesses. Then we have the perioperative nurses. These are nurses that work in the theater. They care for patients before, during, and after a surgery. They are also called the sterile nurses. They ensure that whatever equipment that they'll be using during the surgery is very sterile, and they are the ones that often hand over instruments to surgeons during a surgery. Then we also have the anesthetic nurses. These are nurses that administer anesthesia to patients during surgery. They ensure that their vitals are stable and they ensure that the patient stays alive throughout the period of the surgery. Then we also have the school nurse. These are nurses that work in a school setting, mostly in sick bays and school. They offer first aid services to students. Then we have nurse educators. Nurse educators are like our nursing tutors in school, mostly in nursing school and university. They are trained student nurses throughout the period of their program. Dental nurses, these are nurses that provide oral care services like dental cleaning and filling. That's their job description. Then we have the public health nurses. These are nurses that have done their masters in public health. They seek to prevent disease and also promote optimal health in the community. Then we have the nurse informatics. These are nurses that work in healthcare system, ensuring they evaluate healthcare information. Then we have the oncology nurses. These are nurses that care for patients with cancer. Nurse administrators. These are nurses that work in top management, all the senior nurses. They ensure effective nursing care and also management. Then we have the travel nurses. These are nurses that are always on transit. We provide first aid services to patients on transit that also needs nursing care. The neurology nurses. These are nurses that care for patients with neurologic disorder like stroke and brain injury. So I want you to share with me what nursing specialty you want to venture into. Thank you so much for watching. I will appreciate if you give me a thumbs up and also drop a nice comment on this video. See you on my next one.